Hello, and welcome back to my channel. Today, we're going to dive into an important topic that affects the health and well-being of women and individuals assigned female at birth. We're talking about vaginal discharge. Now you might have some questions, and we're here to provide you with all the information you need. So let's get started. What is vaginal discharge, you ask? Well, it's a natural and normal fluid that comes out of your vagina. It's produced by your uterus, cervix, and vagina, and it serves multiple functions. First, it helps clean and lubricate your vagina, keeping it healthy. Second, it helps fight off bad bacteria and infections, acting as a natural defense mechanism. 1. Normal vaginal discharge. Normal vaginal discharge is a natural and healthy occurrence for women or individuals assigned female at birth. It helps to maintain the cleanliness and lubrication of the vagina, as well as protect against infections. The characteristics of normal vaginal discharge may vary from person to person, but generally, it should have the following qualities. Color. Normal vaginal discharge is typically clear, white, or slightly off-white in color. It should not have a strong or unpleasant odor. Consistency. The consistency of normal discharge can range from thin and watery to thick and sticky. It may also change throughout the menstrual cycle. Amount. The amount of vaginal discharge varies among individuals, and it can be influenced by factors such as hormonal changes, sexual arousal, pregnancy, or the use of birth control. It's important to note that what is considered normal can vary from person to person. If you have any concerns about your vaginal discharge, such as changes in color, texture, smell, or the presence of other symptoms like itching, burning, or pain, it's advisable to consult with a healthcare provider. 2. Abnormal vaginal discharge. Abnormal vaginal discharge refers to any changes in color, consistency, smell, or amount of vaginal discharge that deviate from what is considered normal for an individual. It can be an indication of an underlying issue or infection. Here are some signs of abnormal vaginal discharge. Changes in color. Vaginal discharge that appears yellow, green, gray, or brownish in color is often considered abnormal. These colors may suggest the presence of infection, such as bacterial vaginosis or a sexually transmitted infection, STI. Unusual consistency. If your vaginal discharge becomes clumpy, foamy, frothy, or has a cottage cheese-like texture, it may be a sign of a yeast infection or other vaginal infection. Foul odor. A strong, unpleasant odor accompanying vaginal discharge can indicate an infection, especially if it smells fishy or foul. This can be associated with conditions like bacterial vaginosis or an STI. Itching, burning, or irritation. Abnormal vaginal discharge is often accompanied by itching, burning, redness, or soreness around the vaginal area. These symptoms can be indicators of a vaginal infection or other issues. If you experience any of these signs of abnormal vaginal discharge, it is important to consult with a healthcare provider for an accurate diagnosis and appropriate treatment. They can help determine the underlying cause and provide necessary interventions to address the issue effectively. Remember, seeking professional medical advice is crucial for maintaining your reproductive health and well-being. 3. Vaginal discharge color. As for the color, normal vaginal discharge should be clear, milky white, or off-white. However, if you observe yellow, gray, green, or even brownish-red discharge, it might indicate a bacterial or sexually transmitted infection, irregular menstruation, or pregnancy-related issues. Remember, it's not just about the color and texture. Odor can also provide important clues. While vaginal discharge may have a slight odor, it should not be strong or unpleasant. If you notice a fishy or foul smell along with changes in texture or color, it's important to reach out to your healthcare provider, as it could be a sign of infection. If you experience an increase in the amount of discharge, a change in color or consistency, a foul odor, or any irritation, itching, or pain in or around your vagina, it's crucial to seek medical attention. Your healthcare provider can perform an examination to determine if there's an infection or any underlying issue that needs to be addressed. So, to recap, vaginal discharge is a normal and natural process that helps maintain vaginal health. However, changes in color, texture, smell, or amount of discharge may indicate an infection or other concerns. It's important to pay attention to these changes and seek professional advice if you have any doubts or experience discomfort. That's all for today's video. We hope you found this information helpful and informative. Don't forget to like, share, and subscribe to our channel for more health-related content. Take care of yourselves, and we'll see you next time.